So we're going to review the technique for finding and measuring the inferior vena cava, or IVC. For this ultrasound examination, you can use either a curvilinear transducer or phased array transducer, depending on what's available and patient size and body habitus. In this particular exam, we're going to use the phased array transducer. To begin the examination, I'm going to obtain a subxiphoid view of the heart. I have the indicator pointing to the patient's right-hand side, and as I tilt the transducer up, I can obtain a view of the IVC in its short axis entering the right atrium. Once I have this view, I'm going to slowly rotate 90 degrees so that the indicator is pointed towards the patient's head. And with slight adjustments, I can now see the IVC in its long axis entering the right atrium. Care should be taken to stabilize the transducer with your hand, as it can move as the patient breathes and if your hand moves with gel on the patient's body. If you want to try to obtain precise measurements of the IVC's variation, you can change the machine to its M mode setting and place the M mode line over the IVC. This will provide a tracing showing the IVC at its maximum and minimum sizes as the patient breathes. This method is somewhat susceptible to error with slight movements in the patient's breathing, as well as movements of the transducer. A more practical approach may be to obtain a good view of the IVC and generally assess for volume status by noting whether the IVC is very plethoric and not collapsing very much with respiration, or if the IVC is indeed collapsing and flattening out with respiration, or if it is somewhere in between. And this is the general technique for IVC ultrasound.